Good evening, everyone. My name is Jason Davis, and I am a student at Embry-Riddle Aeronautical University. Right now, I am currently enrolled in Values and Ethics 330, and this is my video blog for Death and Dying in the 21st Century. The ethical issue presented with this topic primarily rests in the field of medicine, particularly in intensive care units having to do with the elderly who are approaching their end of life, or as I like to call it, the final lap of life. Medical technicians who work in intensive care units unfortunately must deal with a number of stressful factors that are riddled throughout the medical industry. Some of them include the patients themselves, the families of those terminally ill patients, agents who work with the law to ensure the last will and testament of the patients is adhered to, if one does exist, and that someone must make that unfortunate call to pull the plug, for lack of better terms. In other words, physicians must sometimes tell the families of the terminally ill that frailty and old age is what is going to take the family member's life. That's unfortunate, but that's life. It does come to an end. There's no way out of it alive. Personally, I would find the aspect of the job gut-wrenching. Delivering that sort of news to a family that wishes for the loved one to live on is that's just hard to make. But the ethical issue that is present in all of this, is it ethical for a doctor to say that a person is at the end of their life and that they can say what happens or could happen in the process of their life ending, such as what to do about it? Examples include, but are not limited to, physician-assisted suicide. The patient is just done. They don't want to continue, and instead of saying pull the plug, they're just saying just take me out, for lack of better words. Other ones include pain pills to help ease their passing, which would probably be the best one. Tube feeding for food and hydration, ventilation to keep them alive, etc., etc. There's a couple of options that we have going on here, but all of which are a little tough to make when you've reached that end of life and the frailty is kind of taken over. Which is the most ethical answer? Personally, I'd argue that the most ethical answer is having the hospital send you home so that you may pass comfortably in the peacefulness of your own home. If that's not possible, then I secede from that thought and surrender that the family be the ones to decide what happens. Again, if that isn't possible either, and the patient or otherwise anybody else really is unable to make that decision for them, then it should just go to the physician. Kind of like a checks and balances. If each one is not available, it just goes and bumps to the next person, legally. But see, that already exists. So what's the ethical issue here? Well, it's personal to each individual. Some may sign a do not resuscitate and just let the journey of life end itself in whatever way it deems necessary. Others may want to keep on going for as long as possible and utilize every means necessary to keep the old ticker a-ticking. Authors Melahat Akdeniz, Bulent Yardmichi, and Etham Kavukcu wrote in their scholarly journal, Ethical Considerations at the End of Life Care, that the main situations that create ethical difficulties for healthcare professionals are the decisions regarding resuscitation, mechanical ventilation, artificial nutrition and hydration, terminal sedation, withholding and withdrawing treatments, euthanasia, and physician-assisted suicide. So a couple more options than what I had already previously listed, along with the ones that I had listed. Like I said, there's a lot of options on the table here, all of which are extremely difficult decisions to make. So my solution, just keep going with them. We just got to keep using those checks and balances, and it's just based off of consent that whoever it is responsible for what's happening, whether it be the patient, the physician, the family, or other legally appointed representative who can make that decision on their behalf in the event that they can't do it themselves. So thank you for tuning in and listening to my video blog on death and dying in the 21st century. Thank you. Have a nice day.